In this video, we are going to define the different employees that are within home health. So I just want to be transparent that this is not an all-encompassing job listing, but I'm looking into the most common ones that when I worked in home health and hospice, these are mostly the job titles I came across, and especially the ones that I see in these reported instances. So certified nursing assistants, better known as CNAs, licensed practical nurses, LPNs, physical therapy assistants, PTAs, and occupational therapy assistants, OTAs. So it's important to understand that these individuals are almost always not exempt due to their pay level as well as their job duties, as they do not qualify as an exempt learned professional, regardless of work experience and training. So you're probably saying, Stephen, this is very wordy. I didn't come up with this on my own, I promise you. This came straight from the Department of Labor's Fair Labor Standards Act documentation. So this is something important to keep in mind, regardless of work experience and training, as it does not require a specialized advanced academic degree as a prerequisite to get that job. Therefore, they're entitled to overtime pay as well as minimum wage. So remember, occupational therapy assistants and physical therapy assistants, they're literally an assistance to the therapy people or the therapist, in other words. So these folks don't require an advanced degree or an advanced academic training or advanced academic degree. So it's not anything to do with training. It's more of the academic degree. So remember, if they're an assistant, chances are they're not going to be an exempt level employee. But again, no level of experience or training will get them to that level as well. So again, these are mostly and almost always 99.9% of the time non-exempt and are due minimum wage and overtime wages as well. Now we're jumping into the folks that are more learned professionals. So registered nurses, physical therapists, I apologize, I left off occupational therapists, medical social workers, or even physicians. So to qualify as a learned professional exemption, the employee must be A, paid a salary or fee basis not less than $684 per week. You can always pay above that. That's not a problem. And then, of course, their primary duties must require advanced knowledge and exercising discretion and judgment. The biggest piece is advanced knowledge in science or learning, and the knowledge is acquired by prolonged course of specialized intellectual instruction. So for sure, it is a very serious matter when you're going through and looking at these folks to determine if they're exempt from overtime or not. If you're not sure, check with the Department of Labor, contact an attorney, or if you have inside counsel, get help from them and assistance to look into those exemptions. So here's the first example. Jason is an occupational therapy assistant who works as an assistant to the physical therapist. Hopefully this is starting to kind of kick in. Jason received the certification from the board and is paid normally $685 per week in per visit pay. So he's normally going to earn that. He might make above it. He might make below it. The question is he due overtime? Well, hopefully you answered yes. Jason does not qualify as a learned professional with specialized and prolonged education, nor a prerequisite for an advanced degree to get that job. He may meet the salary test, but that does not mean he makes that consistently. So sometimes you have to kind of dig in a little bit deeper. Even though you were told he makes 685 normally, that doesn't mean he's going to always make that. Therefore, he must be paid at least minimum wage and overtime for working over 40 hours. So a question that comes up is, can I still pay workers overtime even if they are really exempt? Well, let me put it to you this way. You don't have to always make a person exempt. If you want to pay a person non-exempt for the rest of their career and never pay anybody, a highly comped employee $100,000 or pay somebody's salary, you can absolutely pay people non-exempt. There is nothing illegal about that. So yes, the government will not penalize you for awarding overtime to exempt level staff. But the problem is you can't sit there and call them exempt. You have to treat them as a non-exempt employee. So therefore, you must be consistent in how you pay your staff, how you track their hours. If they're non-exempt, they have to track their hours. That means they have to punch in and out. So some of those people might look at that as offensive, like, hey, I'm an exempt level employee. I shouldn't have to punch in and out. Well, you're going to say very simply and very calmly, I am treating you like a non-exempt employee and I'm paying you overtime. Therefore, you have to punch in and out. It's pretty simple. So remember, you must track their hours and pay them time and a half for hours worked over 40. So you absolutely can pay them non-exempt pay, even if they qualify as an exempt level person.